Syrian culture. People of Syrian culture live in Syria. There are around 18.43 million people residing here. It is a country in Western Asia that neighbors Turkey, Iraq, Israel, Jordan, and Lebanon. The official language is Arabic. Cultural norms go hand in hand with religious practices. The people of Syria welcome all guests into their home by providing food and gifts. Usually these gifts are of high value. It is expected that the receiver will first deny the gift, then when they insist, the guest happily accepts. However, they are opened in private to prevent embarrassment. Furthermore, the groom typically pays for the wedding and provides high-quality gifts to the bride's family. Some gifts that should not be given are art representing human form, dogs, and alcohol. Alcohol is not prohibited, but it is still not acceptable to give as a gift. Another cultural norm for Syrian culture is to kill a sheep and spread the blood on the walls after buying a new car to cleanse it of bad omens. Also, to ward off evil spirits, when a child is sick, it is common practice to roll salt in paper, stab multiple holes in it, and place it under the child's pillow or mattress. Men and women dress conservatively. If someone exposes the sole of their foot to another, it means that they are looked down upon by them. The women of this culture typically are treated inferior to men, and they commonly will work in either agriculture, carpet weaving, or sheep rearing. Nurses are expected to respect one's culture when caring for patients. They should understand that Syrian consists of different religions that follow different practices. The nurse should assess each patient's cultural values to gain trust and mutual understanding of the patient. This culture is very particular about opposite-sex interactions. Therefore, physical contact between a patient and a nurse should only be done with the same sex. Family is valued very greatly, so if the patient needs a bath or to use the toilet, the nurse is usually assisted by a family member of the same sex. Medication should be given only by the right hand, otherwise it is seen as unclean. Syrian culture greetings are typically longer because they often reflect on their well-being. Unlike Western norms, these individuals tend to stand closer to one another. In a formal setting, men are only to shake with their right hand, and unless a woman extends out her hand, it is not appropriate to shake it. In an formal setting, however, if two people are of the same gender, they may hug. Two men may even give 2 kisses on one another's cheek. If someone that is older than them enters the room, it is expected for them to stand. If no seats are available, then they are also obligated to offer their seats. This also extends to women, especially if they have children. It is not ever appropriate for a man to swear in the presence of a woman. Certain cultural beliefs and values will impact the interactions between healthcare providers and this culture. For instance, they prefer to be cared by someone of the same gender. Also, they are not open to discuss sex or sexuality. When interacting with this patient, the healthcare provider should maintain eye contact, avoid asking questions specifically about a man's female family members, ask open-ended questions, speak loudly with passion, and limit saying a flat no, as it is a sign of disrespect. An alternative is to say, "I will see what I can do," no matter how hard the situation may be. Family is the most important part of life. It plays an essential role in the emotional, financial, and social support. This includes the extended family. In order to not dishonor their family, they will put their family's needs above their own. Children are raised to obey their parents and respect their elders. It is expected of them to learn from the mistakes of their family members, as well as have the same political, religious, and social views of their family members. It is important for healthcare providers to identify family dynamics, since some factors may impact the care of a patient. For example, men are the financial bearers of the family. If the father has a medical emergency, he may be reluctant to receive care, or demand releasement before the doctor orders so that he is able to continue working to provide for his family. According to the Cultural Atlas, the mother's role is to fulfill the domestic duties and care for the children. Even though they are expected to marry someone financially stable so that they will not have to work, women are still expected to have a good education. The father is the head of the household. He is the breadwinner and manages their affairs. As mentioned before, children are expected to respect their elders. As the family ages, the men will marry and become the head of their own household, whereas the women will marry and start their own families. Children are highly valued in this culture. Parents will usually pamper their children. However, they are still expected to obey the wishes of the family. Furthermore, they are still punished harshly and sometimes even abused. However, there is still a great deal of affection between the parents and their children. From a young age, Syrian children are told what is expected of them. Girls are taught that their primary role in life is to bear children. Right after a girl reaches puberty and starts menstruation, she is expected to marry and start having children. Boys, on the other hand, especially the eldest son, are responsible for parenting their younger sibling. This culture values boys over girls. Furthermore, parents will shelter their daughters from a young age. While boys are allowed to go outside and play, girls are forced to play indoors with only other girls. Children usually live at home until marriage, which is typically at a young age. The mother is the primary caregiver, while the father has little to no role in parenting. It is very rare for a divorce to occur, but if it does, the children will live with their father. Upon death of a parent, daughters will take over their mother's responsibilities if she were to pass. If the father were to pass, then the eldest son is expected to support the family financially. Syria's religious population is primarily Sunni, so it sets the religious belief for Syria. Syrians' behavior are still defined in the Quran, which is the holy book of Islam, the Sunnah, which is Muhammad's personal deeds and behaviors, and the Hadith, which is the sayings and teachings that should be followed. There are 5 pillars of Islam. Allah is the only God, and Muhammad is his prophet. Prayer should be done 5 times a day, facing Mecca. Money and food should be given to the poor. Fasting should be done during the month of Ramadan, and one should have a spiritual journey to Mecca at least once in their lifetime. Some religious practices are the Feast of Sacrifice and the end of Ramadan. Typically, men will pray in a group and participate in weekly sermons, whereas women will worship in segregated areas of the mosque or at home. As a healthcare professional, they need to understand that patients will most likely refuse to believe that they will die from a harmful disease because only Allah knows when a person is to die. Also, healthcare professionals need to respect their religious practices by allowing family members to assist with the patient's care. Lastly, if resources are available, they should inform their patient about resources needed for their religious practices. Syrians are primarily Muslim, and in the Muslim religion there are some medical practices that are prohibited. For instance, abortions are not allowed unless the pregnancy is a risk to the mother's life or there is proof that the fetus has medical problems. In some states, assisted suicide is legal. However, Syrians do not partake in these practices. Also, they are not to be kept on life support. After death, an autopsy is not to be performed unless the law requires it. And lastly, blood transfusions and organ transplants are permitted, but there are certain restrictions. When they are in an ill state, they will seek Allah's help through patience and prayer. Another healthcare practice is that a newborn boy is to be circumcised. Also, after birth, an elder is supposed to whisper the Islamic prayer in the newborn's right ear. To ensure that the Syrian culture receives quality care, a nurse can be educated in their healthcare practices and beliefs, such as restricting discussions regarding sex or sexuality, knowing that they prefer to receive care from a healthcare provider of the same gender, not performing autopsies after death, and allowing them to seek help from their God by praying so that he can cure their illness. The aim for equitable care would apply to someone in this culture because providing unbiased care is important to decrease health disparities. This is done by not enforcing care that does not follow their religious beliefs and values, as well as focusing on giving the patient the best care they can despite any differences between their patient and themselves. If you have any questions, please comment them below in the discussion post. Thank you.